In today's video, we're going to talk about pelvic pain modifications. If you're tuned in today, you probably are experiencing pelvic pain. Perhaps you've been diagnosed with SPD or PGP, whatever the official diagnosis is, you have pelvic pain and probably separation in your pelvis. So these modifications are going to help support you throughout the rest of your entire pregnancy. I have created a pelvic pain specific workout, but the series is a little limited because once you start to have that separation in your pelvis, you become very restricted on the poses that you can actually do. For example, low lunge, where you're stepping back and you're not as stable in the pelvis, is probably not going to feel very good to you. Another one would be goddess squat, or any pose that's wide and opening up the pelvis is going to make you feel a little more unstable, and it's going to cause more harm than good. So the series is limited, but it's designed specifically to help that pelvis heal. So let's get into modifications. Our first modification is for goddess squat. As you can see, my feet are out wide, I'm dropping down deep into the hips. You can probably tell why this wouldn't feel comfortable because it's opening up the hips, and it's also encouraging the pelvis to separate. Our modification here is to come into chair pose. Your feet are stacked underneath your hips, drop nice and low, engage through the core, and engage through the pelvic floor. Very stable. Another option for chair is to take your Pilates ball or your block, place it just above the knees, and then just bend down. Once again, engaging the pelvic floor, squeezing through those muscles like the Kegel muscles, engaging the lower abdominals, and you're going to feel this burning right away. Compulse into the block, and it's going to create a lot of stability. Our next pose is Buddha squat. Normally you would be dropped down low, deep into your Buddha. Our modification is to set up a block or a bolster and take a half Buddha. You have this leg pulled up, and then you can extend your right leg out beside you, so you're still getting a little bit of broadening. If this is uncomfortable, take the foot into the front. Then if it's in your practice, you can always take that left elbow and press the knee out. You're getting a little bit of stretch, but you have complete control and it's not forced. Our next option, instead of forward fold, which is really opening up through the pelvis, you can take staff pose or dandasana. Come with your feet together. If you want to modify and open the feet up just a little bit, you can, making space for your belly. And then lengthen and simply lean over. You have an option here to keep it very active, which would be with a nice straight flat back, your gaze is forward. Or you can allow your back to round and release through the neck and kind of hang, almost like a rag doll. If you're having trouble lengthening out through the hamstrings and you're having a lot of space underneath the knees, we have an option to set on a block. Isn't my favorite thing. I would say a bolster or a pillow or a blanket, anything that's soft that can help with that pelvic tilt. So as you raise up, it's going to cause the pelvis to tilt forward just a little bit, loosen the low back, and release the hamstrings. So this should be a nice, comfortable pose where you're getting a release in the hamstrings, but you're not hurting the low back. Our next pose is lunge. Now normally you're going to take a wide step out in front of you, drop deep into your lunge. You're trying to stack your knee over your ankle. And you will be lunging like this. If you're having this pelvic pain, this probably is not going to feel good for you. The modification is to simply shorten your stance. So you're more stable here. Your feet are underneath your hips. You can take a block even and place it between your legs to help you remember to engage the pelvic floor and engage the core. And the trick is, instead of having all of your weight in the front leg, you're gonna put more weight into the back leg. Not more than you would in the front, but you're gonna lean heavy on the back leg and squat. You'll see when you try to do this, it actually is a workout. You can also just stay low and squeeze into the block. Either way, your pelvis is very supported. Last but not least is down dog. Everyone's favorite, my favorite. So normally, we're in a nice little inverted V, active through the hands, pressing the mat away, trying to get the heels onto the mat. But sometimes this does not feel good in our pelvis. So our option is to use a chair. Stacking the feet underneath the hips, pressing the heart through the gateway of the shoulders. And breathe here. Those are my 5 modifications for pelvic pain. I hope this supports you and I hope this helps you feel a little bit more comfortable in your workouts. I'll see you next time.